Joe, are you in dialogue much with the regional mayors?
Yeah.
Ocean, Elkhart?
Yeah, they're all, I mean, we don't get together regularly, but we text back and forth.
I didn't know if you had a format for regular dialogue.
We do, but not specifically regarding this. It's monthly we get together and in between as needed, so. All right, I think we'll get started here. I'd like to thank you all for joining us today. I know this was called rather hastily, and in discussions with the health department, we felt it was important to have a press conference today to address the concerns that have recently become quite prominent and significant in our community regarding COVID. Obviously, our concern is the widespread, apparent widespread community spread that's occurring as our local numbers have taken a real jump in the last 10 days. Jumping on the state website, the last 10 days, we've had the 6 highest days of COVID cases. Today being 96, just under 100 cases per day. I think it was a few days ago we hit 90, and it's just skyrocketing right now. This is not good, and I'm not going to take Dr. Remington's, not taking his place here. I'm just trying to underscore why we're meeting here today. State of Indiana went over 4,000 cases yesterday for the first time, and they just updated their website not even an hour ago, and their new number was 4,700 new daily cases. And I also read this morning that the United States had 102,000 new cases. I believe it was on Wednesday. That's the first time they've been over 100,000 cases. So it's a significant problem in our community, but our state and nation as well. But we feel it was very important to sit down and stress the importance of where we are at right now and the importance of social responsibility as far as gathering, mask wearing, hand washing, all the things we've been saying, just trying to hope folks really understand how serious this is. And again, I'm not going to get too much into the weeds. We'll let Dr. Remington do that. But something to note, Kosciuszko County is orange. They're at a level, they're at 2.5, a level orange on the state map, and the next level is 3.0, and that's red. And we sure don't want to get up there. We talked last week about testing and how critical testing has been and how overrun our testing is. We're averaging about 175 tests a day at our Bowen Center site, and that does not include all the other sites that are testing, both CARES Act testing at Medstat and Parkview, clinic out north, and all the other doctors' offices and hospitals testing that's going on as well. So there's quite a bit of testing going on. So with that, I'm going to turn it over to Dr. Remington to give a snapshot of where we are right now and his recommendations as we do this. And before I mention that, I do want to say Dr. Jay Dale is here from Kosciuszko Community Hospital, Lutheran, to talk about the impact on the local hospital as well. So we'll hear from Dr. Remington, then we'll talk to Jay Dale from KCH. Dr. Remington?
Thanks, Mayor. Thanks for inviting me today, and sorry to have to meet on a special occasion over this topic. So lots of numbers I could share, but the bottom line is we're unfortunately setting records now. Nationally, as the mayor mentioned, Wednesday topped 100,000 cases in a single day, which is a new record. The 7-day rolling average is just under that, 90,000 cases a day. That's more than double from a month ago. Indiana cases on Wednesday I had were close to 4,500 cases in a single day. That was a new record. The rolling average in Indiana is getting close to 3,500. That's more than triple than a month previously. So Kosciuszko cases for the month of October surpassed 1,000. Last month was a whopping month. That more than tripled from the previous month. Our Kosciuszko County cases weekly per 100,000 population are at 459, which surpassed last week's 7-day rolling average by 50%. So just as the mayor mentioned, this is a substantial surge, the worst we've seen yet numerically. We are doing a lot of testing. The Bowen Center site, since they started operation 15 days ago or so, they're up over 2,500 tests now. That's a lot of tests, more than I really anticipated we'd be needing at this point in the pandemic. But just to reflect that people are concerned. They're ill, they're close contacts, they just want to test. Employers demanding tests, institutions demanding tests. So lots of numbers, but I want to emphasize that this is not just a testing phenomenon, as I mentioned last week at our press briefing. There's real human damage, if you will, this time around. We are now at 32 deaths for our county. We were at 29, I think, about a week ago. And I want to just tell you that that number is really going to go up in the next 3 weeks, really going to go up. So condolences to those families and those hovering over someone really ill on a vent today. In District 2, which leans to the north of us, right, Elkhart County, St. Joe County, COVID hospitalizations and ICU bed consumption is at the highest ever with this pandemic. In District 3, which leans to the east of us, Allen County, COVID hospitalizations are the highest ever during this pandemic, and ICU bed consumption secondary to COVID in the aggregate of the hospitals there is nearly as high as it was in the spring. So this is clinical. This is not just statistical. Okay. So what in the world's going on here? Well, the answer is no one thing. There's no one place that's the incubator or the super spreader. Lots and lots of people being people, social creatures, lots of social gatherings, small gatherings, somewhat larger gatherings, weddings. And this is very clear regarding the biology of this virus. It's very efficient as a respiratory pathogen with its pre-symptomatic spread. There is no doubt that is a significant player with this. And the story that I've heard several times over in the last 2 weeks is the gathering on Saturday was fun, over dinner, wedding reception, social gathering, nobody ill. By Sunday evening, somebody's ill. They're test positive on Monday, and by Thursday, 6 people at that gathering of 15 or 18 are ill with COVID. Pre-symptomatic spread. So it's really time for action here, Kosciuszko County, and you know how to be good neighbors. Love your neighbor at this point in time. Behave as though you are spreading the virus unbeknownst to you. Social distance. Wear a mask. Certainly in indoor crowded spaces, wear a mask. Avoid crowds in general, outdoors or indoors. If you have the least thought that you're ill, stay home. Don't go to work. And hand washing, just those same messages that we've been saying all along. We have other arrows in the public health quiver we can pull out. No one's too anxious to do that again. Locking down, limiting access to certain venues. Mostly, we want to control spread to the most vulnerable of our society. That's clear. The nursing homes are feeling this pretty bad right now, and we want to continue to really protect them. If you have an indoor gathering that you cannot avoid, or you cannot reschedule, try to bring the outside air in, ventilated as much as you can. And think of immunization, influenza immunization now. It won't help COVID, but it'll help the challenge of addressing people with cough, high fever, body aches 2 months from now. There's very minimal influenza activity across the state of Indiana right now, but it's coming. It always does. So immunize against that pathogen at least. We hope to have COVID-19 vaccine soon. It'll probably go to frontline workers first and roll out in the months ahead to the general population. And that'll be good to have a vaccine. So be good citizens, love your neighbor, do the right thing, be very respectful of this virus. Thanks.
All right, thanks, Dr. Remington. And again, we've mentioned, Dr. Remington mentioned the pressure on the hospitals, and I felt it important to have Jay Dale here from KCH to discuss locally and maybe regionally what's going on with Lutheran Network.
Appreciate the opportunity, Mayor. And I don't want to repeat half of what you said and some of what Dr. Remington said either, but I'll tell you, I guess the message can't be repeated enough in that right now, I think it's very important that our community care for each other. And in doing so, we'll be able to care for them. It really comes down to flattening of that curve that we've heard about and reducing the escalation that we're currently seeing. We are currently able to manage the influx of patients that we've seen, and it has more than doubled since the springtime, first wave, in terms of the number of patients that we've had in the hospital. But we've been able to manage that, working with our network as well. It ebbs and flows, and sometimes on a daily, hourly basis. Patients come in, we assess them, we put them in the appropriate level of care. Sometimes it's the ICU, and sometimes it's not. In any case, we protect them, and we protect everyone in the hospital. If you go to any of these hospitals in our region, you'll notice the consistency in how we protect our staff and the patients and the visitors that we have coming to the hospital. It's critical because we do not want to be, a source point of the infection. And so far, we've not been that. So to some extent, it's a safe haven, and it's important for me to mention this because the rest of the story, when it comes to behavior related to this pandemic, is people are afraid. People are afraid to come see their doctor. People are afraid to come to the emergency room or to get a test done. And this delays really needed care. And I'm not just saying that, to try to promote healthcare per se. I'm saying it because we're seeing the real life repercussions of people that delay that initial care and that initial testing in our clinics, in our hospitals when we test. And so it's just really important that you get to the appropriate level of care as you would have without COVID. And you need to, to some extent, trust that healthcare will take care of you. Again, we're taking every precaution that we know, using appropriate protective equipment, obviously masking, washing of hands. We wipe down surfaces 4 or 5 times a day. Visitors are still limited to some extent. So the exposure is pretty minimal there. So do not delay getting care. As far as capacity goes, I do want to address that. Every hospital has different levels of capacity based on several factors, one of them being staff, the ability to take care of patients, another being equipment or space, meaning that you've got ventilators and you've got rooms and so on. And then lastly, you've got the appropriate level of supplies such as PPE. When all of this started at the beginning of the year, there was a big rush on PPE, and it was very difficult, as we remember, to try to get that PPE, restricted services, things like that, to try to conserve the PPE, and we were able to do that. Now, between then and now, we've been stockpiling, and we've also gotten donations of PPE throughout the community, which we're very, very thankful for. A lot of support, by the way, from the community, businesses and individuals that have stepped up to help out. Tons of recognition out there. And they've really helped our staff get through some rough times. We're well stocked right now for PPE, and I can't see into the future, but we're capable of handling whatever comes at us today. I can report that we've dropped the number of patients by about 40% from yesterday to today. I hope that's the start of the curve going down. My concern is, and I'm sure everybody's concern is, with the holidays coming up and families and everyone getting together, how will that affect and what impact will that have on the promotion of this pandemic? And I think it will have an effect. But for now, we're able to manage it. We're able to manage the patients that are coming in, and primarily it's done because of the tremendous efforts that the staff at KCH, our physicians, our nurses, those that support the frontline staff, everyone is putting in overtime to make sure that we're doing the right thing by the patient. We are affected by our own staff being quarantined, as I'm sure many of you have faced that in your organizations. It has, again, ebbed and flowed depending on the area and the department as well. It is coming from the outside in, not from the inside out. That's important to note. But, and we're hoping that it's going to peak here and, start to back off. But as of today, as of this week, we're doing okay. We're able to care for anyone that comes to our doors. And my hope is that we'll be able to continue doing that. But, I'll just state again how important it is for you to take care of each other out there so that we can take care of you should you need us. Okay? Sort of flatten that curve. That's really my main message, I think. Thank you.
All right, thank you very much. I certainly appreciate it, and I'm sure we'll be ready for questions here in just a moment. I did receive a statement from Parkview Warsaw that I just want to read. Basically, Parkview Warsaw currently has adequate resources to care for patients with COVID-19 and other health needs. However, we are concerned with the rising number of COVID-19 cases in our region. Over the last several weeks, the numbers of hospitalized patients with COVID-19 in the Parkview health system has more than tripled, and new cases continue to trend upward. All of Parkview's facilities continue to maintain full clinical operation thanks to our team's diligent planning and preparation over the last few months, and we will continue to closely monitor the situation. We urge everyone to do their part, wear a mask, wash your hands, avoid social gatherings, and stay home if you are sick. These practices will make a difference and help slow the spread of the virus. Jeff Rocket, Vice President of Outpatient Services, Parkview, Warsaw. So again, I think that's the main purpose of our press conference today, is to stress where we are right now, where we really didn't want to be, how quickly this has come upon us, and I think how important it is to do as was just mentioned. Wear a mask, wash your hands, avoid social gatherings, and stay home if you are sick. Just talking about protecting yourself and your loved ones and everyone around you. I did mention this morning at Board of Works that we have canceled our first Friday this evening. We had 30 vendors scheduled to come downtown on a beautiful night, and I know a lot of people are going to be disappointed. We do have a truck. The idea was Thanks for Giving, where folks could donate supplies to Combined Community Services and Salvation Army. We will have that truck parked at the parking lot here at City Hall with several assistants with masks and gloves to accept those donations, but they will be drive-through only. We ask if you bring donations, you come off of Center Street, pull through the parking lot, stop, make your donation, and then proceed out of the parking lot. There will be no socializing downtown tonight with First Friday. And again, I certainly regret having to make that decision, but I think it certainly underscores how serious we're taking this here at City Hall. I know the weather's going to be great this weekend. I plan on getting out and riding my bike. You need to let's take advantage of the outdoor in very spaced circumstances. Get your exercise, get out and enjoy this beautiful weather. But avoiding those close social situations, both outdoors and indoors, is really very important. Dr. Remington, anything further to add before we go to questions? Okay. All right. Questions? I think they're both on. Yeah.
Jay, you mentioned you're good right now, you're handling everything well, but if it gets worse, I mean, worst case scenario, whatever, what is and the hospitals are filled and there's more patients, is there a plan for the hospital, for the county to send the patients out to other facilities? What's the worst case scenario plan, I guess?
Right. Well, one of the systems that we set up about a year and a half ago now was what it's called a transfer center. And when there's a need to transfer patients between facilities, acute facilities, hospitals, the center is called, and they know who has capacity with all the network facilities. And this includes Parkview facilities, includes the Lutheran Network facilities, those to the north of us. We've had transfers from Goshen, Elkhart, South Bend. It ebbs and flows a little bit. Up until the last couple of weeks, Kosciuszko County was a little bit behind the curve, I guess, if you will, in terms of the number of patients that were hospitalized. We knew that the counties north of us and west of us were getting hit pretty hard. And we're a little bit isolated there for a while. But it has sort of caught up to us. And now, we're at times we'll have to transfer out as well. Now, we typically, if the patient needs higher level of care, they will go to, for example, Lutheran Hospital that has all the specialists and the equipment and everything necessary to take care of that patient. And so you have to find the right facility when you're doing that sort of program. But that network exists. It doesn't look at, who owns the hospital or what type of hospital it is. It looks at capability and capacity. And we're able to manage that, pretty well, because not everyone usually gets hit all at once. It's usually regionalized, and there's some up and down.
And are you finding with the surge in the COVID patients that other care is being put off? Maybe that's not necessary. Is that happening? Or?
Yeah, I don't want to get into details, but in general, we're finding more advanced disease coming in when people do get tested. And that creates potentially more complications, more difficult interventions, whether it be surgical or otherwise. So it's, again, important, I think, to address things early so that it doesn't get to that point, because it makes it more difficult to recover, obviously, if you have more issues going on.
And maybe this is for Dr. Remington. Y'all talk about masks, but I'm seeing people not wearing masks. I'm seeing people say masks don't work. I mean, at what point does the county, or do you say, okay, there's a mask mandate for this county? I mean, we're not there yet, but it sounds like we're going that way. I mean, what's the criteria for a mask mandate?
So there is no single threshold that you cross. A lot of it is due to your willingness in your population to do those things. So, you know, in this county, it doesn't go so well with that recommendation. A lot of counties, it doesn't go so well with that recommendation. So this is all voluntary at its base. You can make it more coercive. You can do fines, other things. It's really, I think, hard to pull that off. There has to be significant political will to do that. And I think this deep into the pandemic, what, month 8 or so, there's just a lot of attrition on everybody's part to be desirous of going back to those kinds of strategies coercively. There's a lot of carnage of its own, if you will, from those strategies several months ago. So that's why we don't want to sound hollow, but yet are pulling on the greater strengths of our neighbors to do the right thing. That's the best answer. Masks do seem to make a difference. They do. This is a respiratory pathogen. It's a great way to at least improve source control, controlling what comes out and spreads from the nose or mouth of someone who is ill and may not realize it yet, or is infected, may not realize it yet. So masks definitely have their place.
And I would just add to that, you know, that's really why we're here today. Again, not to beat anybody over the head with a mask mandate. I don't think, I agree with Dr. Remington. He was very well said. People need to understand the ramification of not wearing a mask and understand how critical we are, at what stage we're at. It's never been more problematic than what it is right now at this very minute. And wearing masks and having a nice weekend where people are going to be tempted to go out and congregate potentially without masks. It's just, that's our purpose today, is to raise the level of awareness another notch, probably about as high as we can, without standing up here and again beating people over the head with a mask mandate. That I don't think is the way to go about it. So again, Dr. Remington said it very well. They work. If there's ever a time for people to maybe try and care for themselves and their neighbors, this is the time to do it. And I know, unfortunately, it's become somewhat of a political issue, which we've pretty much kept that out of our discussion, and we'll continue to keep it out of our discussion because politics has no place in mask wearing. It's public health, and that's why we're here.
And schools are still not the breeding ground for this, correct? I mean, yeah.
That's correct. I hear that echoed from the state. I had a nice exchange with the Deputy Health Commissioner by email early in the week and applauded our efforts locally to try to keep the schools open. That from their perspective, just like ours, we just don't see evidence that they are the incubator or the super spreader, if you will. They are reflecting what's going on in the community. It's what's coming in rather than them sending it out, as Mr. Dale mentioned. Yeah, it's exactly the way we see it. So the state appreciated our approach to try to do that. Schools, just like hospitals, are a pretty safe place, we think. They're controlled. Send those kids home and they're going to gather. Not such a controlled setting. And the academics are extremely difficult to pull off when they leave traditional in-class learning.
So obviously First Friday was canceled tonight. Should more, I don't know of any other community events coming up, but should those proceed with caution or?
Right, I think proceed with caution, and at the health department level, we have been receiving lots of phone calls. Mr. Weaver in his office receives lots of phone calls from people vetting a planned event coming down the road, and we're happy to be there. We help them think through it. Some things should probably be rescheduled.
So I have a couple quick questions. First off, what is the county's current situation with long-term care facilities? Are cases increasing there? Are they about the same as they were a few weeks ago? What does that situation currently look like?
Well, I had a phone call earlier today with a particularly pressing situation in one of our nursing homes right now. And so we hear those anecdotes. The aggregate numbers are not immediately available to us as a local health department, and you can kind of get to that a bit at the state's dashboard. But we get anecdotal phone calls from administration or nursing staff wanting some guidance, and we're getting more of those phone calls in the last week.
And then my last question is, based on how numbers are currently going, not just here county, but statewide as well, do you guys foresee us reverting back to the 5-stage reopening plan that Governor Holcomb had previously implemented? Do you see us going back to that, or any other new steps that might be brought into place?
I don't know that I can answer that. I don't know what the governor's thinking.
That question was posed to the governor on Wednesday at his press briefing, and at that point, he suggested that he had no plans to move backwards. That doesn't mean that that's off the table, and that's probably the best that I can answer it as well. I think we're trying to, again, we're here to try and get folks to be socially responsible so we don't have to do that, and that's our message today. But, you know, if these numbers continue, if the hospitals become overrun, I know the state's dashboard, the state's decision-making is number of cases, the amount of tests, the contact tracing, and the hospital utilization. I think those are the 4 pillars that the governor makes his decisions based on. And I know they're watching those numbers, and they have from the beginning. And that's why I think it's so important to follow the work of the State Department of Health as they've filtered down that information to the local departments of health. Certainly we can make decisions here on a local level, but I've certainly found that we have done a good job following the state. I think the state has done a good job using public health data to make their decisions. And I know it's not easy for a lot of people to swallow at times, but at the end of the day, I think it's the right thing to do, and I truly believe that locally here we will continue to follow what the state does. And again, to answer your question, I don't think anything's off the table. Anybody else? I'm going to throw in a quick unrelated note, just to be careful with leaf burning. It's very dry out there, so if you just be careful with that. All right, well, we still plan on meeting here again next Friday as we had originally planned on our regular every other week conference. Again, certainly appreciate your joining us today, and please understand how important it is that we all do our part as we move ahead, as we move into a beautiful weekend. You know, get outside, enjoy the outside. You know, we're not telling anybody to go hide, but we just really want everyone to be as responsible as they can to take care of both themselves and those around them. So, all right. Anything else, Jay? Okay. All right. Thank you all. Thank you. All right, Jay. Thanks so much.
Yeah, appreciate it.
Thanks, Jay. That was well put.
Yeah.
Let me know if you need anything.
You bet.